You're listening to Upgrade Your Health and Wellbeing podcast. Take care of your health and change your habits for the better.
Welcome to another episode of the podcast.
Upgrade your health and well-being.
And today we can improve our health and well-being with omega-3 fatty acids. Arek, what kind of omega-3 fatty acids do we have?
There are three main types of omega-3 acids, these being ALA, EPA, and DHA.
Omega-3 fatty acids, why are they so important for us, for our body?
First of all, these are polyunsaturated fats, which must be delivered to our organism because we, in fact, cannot produce them on our own.
And how can we eat, fish so that we don't have to take supplements?
Definitely, as far as the intake of omega-3 acids is concerned, the intake of fish or different types of fishes is best, absolutely the best. Here we are talking about mackerel and other forms of fish, such as sardines, etc. Herring, for instance, is an excellent source of omega-3 acids.
Well, but in conditions like in Poland, for example, eating fish is not very common, unlike in the Mediterranean region or the Far East or in oceanic regions. Therefore, here, a certain standard is to use omega-3 fatty acids in the form of dietary supplements.
Of course, we need to remember one thing, which is related to the proportion between omega-3 acids and omega-6 acids. Because very often, at least I come across the information that omega-6 acids are definitely problematic. They are also essential. They must be included in the diet. The problem is that there is absolute incorrect proportion between them. I mean, like in the Western diet, too many omega-6 acids compared to omega-3 acids. And therefore, it should be the other way around. And then we can talk about good health.
I think we have a specific indicator that tells us what the proper ratio between omega-3 and omega-6 fatty acids should be.
Yes, total oxidation value is the index that tells us about, maybe not so much about the proportion, but about the quality and the marker of omega-3 acids. The lower, the better. Generally, it is said that if it's below 20, 25 or 20, it is all right. But we need to remember one thing. Out of all supplements available on the market, omega-3 acids are the least stable. And we need to stress that. They are definitely the least stable, which means that, in fact, this index is not the determinant, although, of course, the lower, the better, as I said. But this is not the only inclusion criteria whether we need to bear in mind when choosing our supplement as such. And since you mentioned the proportion, ideally, definitely it would be all right if omega-3 acids were higher compared to omega-6 acids, since both of them have anti-inflammatory properties. But unfortunately, when in excess, omega-6 acids are pro-inflammatory, and we need to remember about that.
But when we talk about the anti-inflammatory effect, well, as I understand it, omega-3 works wonderfully as an anti-inflammatory. So let's discuss what benefits we get from using omega-3 fatty acids.
There are two main organs that are related to the benefits of having omega-3 acids. These being, first of all, the brain. We cannot function without the adequate amount of omega-3 acids. The eye, for instance, right? Omega acids are essential in here. In patients with some autoimmune diseases, when doses of omega-3 acids were administered, the authors of the studies discovered definite decrease in inflammatory condition. So we could say that omega-3 acids definitely possess or exert some kind of function which is connected with decreasing inflammation, which is crucial in such diseases like arthritis, for instance, rheumatoid arthritis, lupus, and so on and so forth.
Although for me, I have to tell you, the most important are the brain functions. I don't know if you know that half the mass of our brain is fat in general, of which 1/3 is omega-3 acids. I don't know if you knew that.
I did know about that, but I need to tell you, of course, like next to cognitive functions, I believe that cardiovascular health is also of great importance, right? In terms of decreasing cholesterol levels or TGs.
Which is great news because we can naturally lower our cholesterol levels, and also the risk of cardiovascular diseases drops significantly. However, omega-3 acids also form myelin sheaths or are part of the nerve cell. In what way, what functions in the brain area can also be influenced by omega-3 acids?
First of all, there is neuroprotective function. This is the most crucial aspect, and generally there is the decrease in neurodegeneration, which is of common occurrence in today's world, right? Because we are bombarded with lots of toxins, and therefore omega-3 acids somehow exert the protective function on neurons as such.
This has a strong connection with various diseases, for example, with depression. Of course, depression is a very complicated disease. It depends on many different factors, but also when it comes to proper nutrition, it has a huge impact on depression. And omega-3 acids, their supplementation, can significantly improve the prognosis for this disease. But also, if we want to think about protecting our nervous system from external factors, omega-3 acids are extremely important.
Absolutely, they are, as you said, as you stressed, they are of crucial importance. The problem is, first of all, with dosing and dosage, because according to the general recommendations, between 250 milligrams to 500 milligrams might be considered sufficient.
And that's consistent with the WHO. The WHO recommends roughly 250 milligrams per day as the proper dose, but in clinical trials, the most common dose that appeared was about 3 to 4 grams per day.
I take personally 4,000 milligrams as such, and so far I have noticed, first of all, improvement in cognitive functions.
However, you can test your level of omega-3 fatty acids. I simply look at the studies. When it comes to manufacturers, there are of course different ones. We must remember the quality of the products we take, but the biggest and best indicator is simply a laboratory test. And we can test our level of omega-3 fatty acids, whether we are within the norm, below it, or absolutely within the norm. But can you overdose on omega-3 fatty acids?
Well, in fact, a general upper normal limit for human beings is at the level of 4,000 milligrams. However, from time to time, there were some studies that reported higher doses, but we need to remember that, of course, there is always benefit-risk ratio. And in this case, we need to focus on the two things. First of all, the quality, and then the dose. Sometimes too much does not mean too good in this case. So I would say that 4,000 milligrams should be all right. Still, we need to bear in mind one thing. The fact that it's written to 4,000 milligrams or 3,000 milligrams does not necessarily have to be true, because we need to remember that there can be also vitamin E included or some other oils. And that altogether makes 4,000 milligrams. So sometimes other oils are also added. So I would be skeptical as far as observing 4,000 milligrams on the pack is concerned, because sometimes it's in fact not 4,000 milligrams of omega-3 acids.
That's why it's very important that you consult with your attending physician, your family doctor, or another doctor who deals with public health, because a specific dose is not right for everyone. And could there be any other side effects?
Well, there are some mild adverse events reported, these being fishy aftertaste, of course, and in doses over 4,000 milligrams, some authors reported loose stools, so diarrhea as such, right? And sometimes some authors reported some cardiac problems, especially arrhythmias. So we need to bear in mind that this 4,000 milligrams is the upper limit as such.
I hope we've convinced you that omega-3 fatty acids can be a wonderful way to start the day, because personally, I don't know if you know, Arek, but I start with 3 tablets, because that is 1 tablet is 1 gram, so 3,000 milligrams, 3 grams of omega-3 is what I normally take.
This is a very crucial supplement, as you stressed. I always take it together with vitamin D and some other supplements, which I'm going to talk about in some other episode. And now some time for evidence-based data. Here we go. So let's start with the fact that supplementation is associated with a 20% reduction in the risk of developing dementia. In adults aged 50 to 75, supplementation of about 2,000 milligrams per day improve memory performance. And omega-3 acids help prevent atherosclerotic plaque formation by lowering non-HDL cholesterol. 2,000 milligrams per day reduces level by 4 milligrams per deciliter. A 2024 analysis found that 4,000 milligrams of omega acids daily reduce cardiovascular mortality by 18%, with EPA providing greater benefit. Furthermore, it's excellent for dry skin, slows down aging. Also, it decreases transepidermal water loss. And omega acids provide an inner protection from UV light. As regards other dermatological conditions, it is useful for psoriasis, dry skin, irritation, oversensitive skin, acne, and tendency to redness. Furthermore, it also decreases fatigue and mood swings. Of course, patients should always talk to a health provider before starting supplements if they take blood thinners, have bleeding disorders, are pregnant or breastfeeding, or have heart conditions. Supplements with vitamin E also slow down lipid peroxidation, which is of paramount importance here. And one more crucial aspect, omega-3 must be stored in the fridge, bearing in mind that marinated fish, herring in vinegar, steam cooking are those products and approaches that are one of a kind.
Thank you very much for listening to this episode.
Thank you very much, and see you next time. Take care.
Upgrade your health and well-being podcast. Take care of your health and change your habits for the better.